Hemifacial microsomia is a facial difference characterized by an asymmetry between the left and right sides of the face. It can affect any portion of the face, from the eye, the ear, the skin and soft tissues of the face, the lips, and the jaw. Everybody is affected differently by hemifacial microsomia, and not everybody has all components. The cause of hemifacial microsomia is unknown. We know that it can affect the structures formed by the first and second pharyngeal arches, which are part of normal fetal development, but we don't know why this occurs. Most patients with hemifacial microsomia will be the only ones affected in their family, suggesting that this is a spontaneous mutation in their genetics, rather than something that is passed through families.
Hemifacial microsomia is usually diagnosed upon birth when seeing that a baby has some facial asymmetry or differences in the facial structures. Usually just affects one side of the face, and it involves an underdevelopment of that side. It can involve anything from the eye being slightly different position to the cheek being thinner on that side, the jaw being slightly underdeveloped, and a cant or an incline to the bite. Sometimes you see differences in the way the face moves on the affected side. And for some children, they have a much less developed ear on that side. So it's really taking into account the constellation of all these different findings that come together to form a diagnosis of hemifacial microsomia.
At Boston Children's Hospital, we like to evaluate patients with a suspected diagnosis of hemifacial microsomia as soon as it's recognized. This gives us an opportunity to provide information about future treatment options and to make sure that we're not missing any components of the diagnosis. There are some patients with hemifacial microsomia that will have other findings outside of their facial structure, and so we like to screen for these as early as possible. A small group of patients with this diagnosis will have obstruction of their upper airway and inability to breathe safely. This can really affect the ability to feed and grow normally in a young baby or child. And so at Boston Children's Hospital, we like to evaluate for this problem very early. We have a great team of surgeons, airway experts, eye doctors, dentists, orthodontists, and many other providers to help support the journey of the patient and family with hemifacial microsomia.